Hey guys, in this video we are going to talk about the regulation of blood pressure. So in previous video we have seen the systolic blood pressure and diastolic blood pressure and how both get affected by the different factors. So we learned that systolic blood pressure is mainly affected by the volume of the blood. So cardiac output will affect more, and diastolic blood pressure is mainly affected by the peripheral vascular resistance and the compliance of vessels. So constriction and dilatation of vessel will lead to diastolic blood pressure changes. Now the difference between these two, that is systolic minus diastolic, is pulse pressure, and pulse pressure can be increased if systolic blood pressure increases or diastolic blood pressure decreases. So for systolic blood pressure to increase, there must be stroke volume should increase. So and the diastolic blood pressure to decrease, there should be decrease in the compliance of arterioles. That's why pulse pressure increased if there is increase in the systolic stroke volume, that is stroke volume, sorry. So stroke volume and compliance of arterioles. Decreased compliance of arterioles will lead to increase in pulse pressure. They are both inversely proportional. Decrease in compliance of arterioles lead to decreased diastolic blood pressure. That's why pulse pressure will increase. Now, mean arterial pressure is diastolic blood pressure plus 1/3 of pulse pressure, and we can derive this equation by this simple formula that pulse pressure is systolic blood pressure minus diastolic blood pressure. So if you put this, then we can derive this equation: 2/3 of diastolic blood pressure plus 1/3 of systolic blood pressure. Why we have divided this way, 2/3 and 1/3? Because if you see the cardiac cycle, the systolic part is less and diastolic part is more. It is like 0.3 second of systole and 0.5 second of diastole. That's why we have divided 2/3 and 1/3, and we can calculate this mean arterial pressure. Another way is by calculating cardiac output into total peripheral resistance. So cardiac output means stroke volume into heart rate, and here now the regulation part. So 3 mechanisms we have in the body for regulation: rapidly acting, intermediate and slowly acting. In rapidly acting, mainly the nervous system will give reflex. So rapidly acting system, baroreceptor, chemoreceptor and CNS ischemia. In intermediate, there will be capillary fluid shifts. So what will happen, that due to this mean arterial pressure lowering effect, there will be hydrostatic pressure decrease. So hydrostatic pressure decrease will cause increased fluid into the capillary from the interstitial compartment. We know that in extracellular fluid there is 2 compartments, blood and interstitial. So this more fluid will come into the capillary, and that's how there is increase in the blood pressure. So in need time, I mean in the shock, there can be 300 ml of blood can shift like this. So this is intermediate acting, means somewhat time consuming. So minute to hours will take for this system to work. Now the slowly acting is RAS, we will see in detail, and it takes days to week. So quickly learn about this rapidly acting mechanism, that will take seconds to minute. So by baroreceptor, chemoreceptor and CNS ischemia. Baroreceptor are of mainly 2, carotid and aortic sinus. So carotid sinus and aortic sinus, as you can see, carotid sinus is in the internal carotid artery and aortic sinus in the arch of aorta. So this is arch of aorta, this is common carotid artery, this is subclavian artery, and common carotid artery is divided into internal and external carotid, and internal carotid have this carotid sinus. Now this carotid sinus is supplied by the ninth nerve. This is known as sinus nerve, while the aortic sinus is supplied by the aortic nerve, which is 10th nerve, means vagus, and this is glossopharyngeal branch. So this you have to remember, this is supplied by the ninth nerve, this is supplied by the 10th nerve. Now what will happen? So imagine a person is standing, now he is lying down, so in supine position. What will happen? While in standing, there will be effect of gravity and all the peripheral blood will pull into his legs. But as soon as we lie down, what will happen? We have learned that factors that are increasing the venous return is one, supine position. So as we lie down, effect of gravity will be gone and all the peripheral blood will be going into the heart. So this going to the heart, venous return will increase, and that's why stretching of baroreceptor. Why? Because mean arterial pressure will increase due to increase in the cardiac output. Because venous return increase, तो उससे cardiac output भी increase होगा and उससे mean arterial pressure भी increase होगा. Now this stretching of baroreceptor will cause stimulation. So firing of 9 and 10 nerve will be there, and this 9 and 10 stimulate two things, mainly nucleus tractus solitarius, that is NTS. You can remember NTS. So N 9 nerve, T means 10 nerve, and S means 7 nerve. This is the nucleus made up of this 3 nerve nucleus. What will happen? It will release the glutamate neurotransmitter. We know glutamate is a excitatory neurotransmitter, so it will excite this caudo-ventrolateral medulla. So there is two type of medulla involved here in the blood pressure regulation. One is caudo-ventrolateral and one is this rostral-ventrolateral medulla. So this caudolateral, so let's see, this caudo-ventrolateral medulla is a depressor. It will cause decrease in the heart rate, decrease in the blood pressure, while the restro has totally opposite effect. It will stimulate the sympathetic flow, that's why increase in heart rate and increase in blood pressure. It is also known as vasomotor. Now, so what will happen? This caudo-ventrolateral medulla will be stimulated and it will cause GABA release. So by GABA release, it will inhibit this rostral ventromedulla medulla and will cause decrease in sympathetic outflow. That's why heart rate and if heart rate decrease, the stroke volume will decrease, so the cardiac output will decrease. That's why systolic blood pressure will decrease. Plus peripheral vascular resistance will decrease. That's why diastolic blood pressure. So overall mean arterial pressure will decrease. Now there is also another effect. This nucleus tractus solitarius will also stimulate the nucleus ambiguous. It will cause increase in vagal outflow. It will cause decrease in heart rate, decrease in cardiac output, and ultimately decrease in the mean arterial pressure. So the main effect we have seen here is by lying down that the pressure was increasing. It was causing stretching of baroreceptor, but body has tried to regulate it and ultimately normalize the, means decrease the mean arterial pressure. Now the totally opposite thing will happen when we stand up. So when we stand up, there will be peripheral pooling of blood into the peripheral part, and this will cause mean arterial pressure decrease, and that's why baroreceptor discharge will be decreased, and this decrease in baroreceptor discharge cause ultimately, so if this GABA release will be decreased, what will happen? This rostroventral medulla will be stimulated. That's why mean arterial pressure increase, heart rate increase. One main thing you have to remember, that stretching of baroreceptor means stimulation of baroreceptor will cause decrease in mean arterial pressure by increasing the parasympathetic outflow by nucleus tractus solitarius, stimulating the caudoventral, that is depressor, and causing this nucleus ambiguous, means vagal outflow. Okay. and totally opposite effect will happen here. Now the first one to normalize is heart rate, because heart rate is dual supply, sympathetic and vagal, but the blood pressure is mainly the sympathetic control only. Now yes, the renin angiotensin aldosterone system, that is a long acting one. I forgot to tell you was that this chemoreceptor and CNS ischemia. So chemoreceptor will act as mean arterial pressure less than 70 and this less than 60. So if less than 70 will happen, less than 65 will happen, what will happen? The PO2 decrease, PCO2 increase, H plus increase, and that's why chemoreceptor will be stimulated, and this both will cause rostroventrolateral medulla activation. So sympathetic outflow will be increased, and this baroreceptor working range is 50 to 200 mmHg. Now the renin angiotensin aldosterone system. First, what are the stimulators? So any hypovolemia, hemorrhage, hypotension, renal artery stenosis, then cirrhosis, congestive heart failure, any condition in which your body tissue is not getting enough blood supply due to either loss of blood, as in seen in hypovolemia, hypotension, hemorrhage, or in condition in which so cirrhosis, the blood will be more like in ascites, and there will be less blood in the actual blood vessel. Congestive heart failure, the heart is not working properly, so the cardiogenic shock will be there. Prolonged prolonged standing, and renal artery stenosis, in which kidney is not getting blood, that's why it will cause increase in renin system. So this all factor will cause the renin to be stimulated, so renin stimulation will be there. And the effect are, we know that the renin stimulation will cause angiotensin means angiotensinogen, that is from the liver, to convert into angiotensin 1, and this angiotensin 1 will be converted into angiotensin 2 by the enzyme ACE, that is angiotensin converting enzyme. So angiotensinogen, that is secreted from the liver, renin will convert this into angiotensin 1, and this angiotensin 1 will convert into angiotensin 2 by ACE, that is secreted from the lungs. And this angiotensin 2, what will happen? This angiotensin 2 will cause all of this effect like vasoconstrictor, increased fluid intake by subfornial organ stimulation. So subfornial organ stimulation will cause increase in thirst. It is a thirst center, subfornial organ, and it will cause more fluid intake. So increased fluid intake, vasoconstrictor, increase in sodium reabsorption through thick ascending loop of Henle, and aldosterone release, and it will cause increase in sodium absorption from collecting the, and it will cause increase in blood volume. So this is all are measure to increase blood volume. Increase in sodium, this will cause from the loop of Henle, and PCT, this will from the collecting duct, and increase fluid acting. This all three will cause increase in fluid volume, and this vasoconstriction will lead to increase in TRP. See, we know that blood pressure is equal to cardiac output into TRP. So cardiac output will be increased by increased fluid, and TRP will be increased by vasoconstriction. Now, other CVS reflexes are Mary's law, Bainbridge reflex, and Bezos-Zarisch reflex. So, Mary's law states that heart rate is inversely proportional to the blood pressure. It is simple. Now, Bainbridge reflex. So, remember B that it is not a bradycardia but tachycardia inducing. I have remembered this way that it is totally opposite from what it is saying. Now what will happen when you give more IV fluid, or by any cause there is increase in the this volume of blood, so what will happen that the atrial stretch reflex will activated. How? So there is receptor present in the atrial wall that are volume receptor, so it will check the volume that will come into the atria. So if increased blood volume, there will be increased filling of atria, and increased filling of atria will lead to atrial stretch reflex, and it will cause increase in atrial natriuretic peptide. It will cause natriuresis, increase in heart rate directly inhibiting the action of vagal nerve. Vasodilatation will happen, and decrease in ADH. That will cause decreased water reabsorption, so diuresis. So these are all the measures to decrease the fluid that have increased inside this body. That's why atria is stretching more and giving atrial stretch reflex. So natriuresis, increasing diuresis, vasodilatation, and increase in heart rate. So tachycardia. Now this Bezos-Zarisch reflex is coronary chemoreflex, in which there is sudden intravenous substance release like capsaicin, serotonin, polybiguanide, and veratranide. It will cause stimulation of coronary arteries, and this coronary artery stimulation will cause bradycardia and hypotension. Now in a patient of MI, what will happen? This accumulation of toxic metabolite will increase coronary chemoreflex, and that's why this hypotension and bradycardia will happen. This is about the pathology part of the blood vessel that I will cover in the next video.